Good morning. It is 10:03 a.m. on Friday, July 11th, 2025. Call this meeting of the Wichita County Commissioners Court to order. A full house on a Friday. Must be some good stuff on the agenda. All right, item number one is a presentation and discussion with Texas Tech regarding medical, mental health, and dental services for inmates. I'd like to invite Corey Schenk, Senior Managing Director, Strategic Initiatives, and Kiana Caruso, Project Manager of the Office of Strategic Initiatives for the Texas Tech University Health Sciences Center. Come on down.
All right. Thank you, Judge Johnson. Good morning, Commissioners. My name is Corey Schenk. I'm the Senior Managing Director for Texas Tech Health Sciences Center in a division called Strategic Initiatives. That division is kind of a non-academic, non-clinical. We don't run the clinics. We work with different strategies. So one of the things we've been doing for the last 30 years is doing the TDCJ healthcare services in the prisons in the north and west side of Texas. So you're familiar with the all red unit here. We provide all the healthcare services out of that facility, including the mental health, the psychiatry, the medical, nursing, and the dental services. And so we've been doing that for about 30 years. In the last several years, the Strategic Initiatives Department was built to kind of reach Texas Tech into the communities where we already have presence or where we have campuses, and now we have Midwestern State University as part of our system. Wichita Falls is kind of a location where we're looking to see if there's any ways we can help our communities and our partners in the communities continue to advance their healthcare services. And kind of what happened with the jails is we work with Lubbock County. University Medical Center is the healthcare entity, so and how it's a little different than in your county. So they have the contract with the county to do healthcare services, and they've contracted with us. We took over that contract in December of 24. We were asked to do that because we're a local partner. We have access to specialty health services and all these different things. So they said, can you apply your prison health care over to county jails? And we're like, we think we can. So we went through and did an assessment. Kiana and I are the ones that initiated that contract. So if she had any more technical questions, we did the setup. But I guess the point is we applied our logic with prisons, and we were told, well, maybe it's a little different. But we found out it's not really. It is different, but it's different in a way that the sheriff's departments are very committed in getting access to health care. So it's actually a really good process for us to move over. So we actually had more smooth skids working with Lubbock County, and in our other conversations with different sheriff's departments, we find that is a really, being smaller and being county employees, the partnership with healthcare and security is much better. And so I guess we've just done really well. We weren't really thinking of creating a process to provide jail services, but we started getting phone calls from people like Yoakum County, Taylor County, asking us if we would consider working with them because somehow Lubbock County Sheriff's Department was talking to their counterparts in the different SOs and saying, we've done really well. And so we just decided to commit ourselves, and Kiana and I are the leads on that, to go around into the different counties where we feel like we could provide health services, especially kind of in our catchment or area, like I said, where we have campuses, and just start discussing if there's an opportunity where Texas Tech can leverage our resources locally. Because we were talking to Captain Patterson, we have a whole dental team already here in Wichita Falls that are providing correctional dental services. We have operational leadership based out of Wichita Falls for regional. So we have the assets already in place to really apply the Texas Tech model of healthcare services. So that's kind of why we reached out to what we originally reached out to Sheriff Duke, and then we got a hold of Captain Patterson and Chief Rutledge, had a brief conversation. We came and toured the facility. By the way, I would recommend you invite a bunch of people from the different counties to visit your facility because it is literally the coolest jail facility we have ever seen, especially Kiana and we're talking about medical. So it was really a really good opportunity for us to look at using that facility as kind of a model of a new way of treatment, because you have these pods where you have access, pod-based potential access to healthcare services where most jails don't have that. We're talking like Montgomery County, and they're just one long deal, so it's like more than a quarter of a mile to get from one end to the next. Wow. So it's a really good facility, and it was eye-opening for us. So we are here today to answer any questions and tell you anything you need to know.
Okay.
How many folks at Allred? How many inmates?
I think already, if I remember right, it's around 1,800 inmates.
1,800.
Yeah, it's a very large facility, extremely well run from our side and the TDCJ side. I will tell you that it's kind of our flagship. Like if we're going to look at how our operations are running for Texas Tech, comparing, we have Bill Clements, we have Montford, we have Robertson, Middleton, and Abilene. They're all about the same size, but typically we try to model our services at Allred. We have a really good team here.
Do you have anything that's our size today, 550, 600 inmate facility?
Yes, we have like small ISFs, we have small facilities like in Havens and Brownwood. They're very small, so that where the access to healthcare is scaled down. Yes, sir.
How many personnel do y'all have that serve the population at Allred?
At Allred, let me think through this. I'm gonna say probably around 60 to 75 staff, clinical staff, and support staff and physicians and providers. It's a very large facility for us.
All on site?
Yes, sir. We do. I will say one of the things that Texas Tech does bring to the table is virtual health as an augmentation and supplementation for things. So a lot of times what we can do, so one of the mantras that we've had with county jails is the same mantra we've been working with TDCJ, is we're more focused on maintaining high quality care while you're reducing transportation. So
Yeah.
a lot of times we're talking about offsite care, cost for offsite care, and how do you reduce that cost for offsite care? If someone needs to go to the hospital, you're not going to save that cost. So we try to get out of that model of saying, well, we're gonna cut off your we're gonna reduce your offsite care. What we wanna do is reduce your transportation. That should, by definition, reduce your offsite care access, but we're talking more like specialty care. So someone comes in, they have a consult for specialists. We can do that via telehealth. We can decide whether or not they need to leave the facility to go to a procedure, then they go to the procedure. And then we continue to work with our specialist partners to do the follow-up care remotely. So we're not sending people out into the communities to offsite locations unnecessarily. So that's kind of our model.
How
The
do
most,
you,
I'm sorry,
No,
most
no,
of
go
the answer to your other question, yes, it's almost all on site except for what we might supplement provider care for.
on the mental health side,
Yes,
can you just provide an overview of the services that you provide, like at Allred, or no, better yet, like at Lubbock County?
Well, in Lubbock County, we don't do the mental health care. We do the medication management with the LMHA.
Okay.
So Star Care is the local mental health authority, and they actually do the programming. In the jails versus prisons, the mental health care processes are a lot different. So in the jails, when we work with jails, it's more programming, medication management, crisis management. In TDCJ, we're looking at more programming, counseling, long-term programming, personality disorders, seriously mental health, things like that. So when we're looking at working with your facility, it's kind of a combination, because we would offer those mental health services in the jail. It would include like detox. It would include all the programming. And kind of what we were talking about is working with your competency restoration program with your LMHA, working with them and collaborating, because the LMHA needs to be the contract holder for the initial assessment for competency restoration in the jail facility. That's just the state law. Star Care in Lubbock is actually the one that kind of built that law.
Yeah.
And so what we would do is work with them and contract with them, and when they do that assessment, provide all the psychiatry care, all the mental health counseling, all the group therapy, individual therapy, medication management, administration, to support the programming for the jail-based competency restoration, but also all of the other programming necessary to either transition to TDCJ or to transition back to the community, so that when they're back in the community, their mental health is well managed.
Yeah. Okay.
And I would say that the model that so Kiana is our project manager. She did an analysis of your last RFP, your staffing, and all that stuff that was in the RFP. And very generally, that's similar to what we would probably present, maybe a little different, but we think that model is the right model for you. I will say different counties do different things.
Yeah.
So when we come and work with any county, we'll decide what your appetite for programming mental health is. Jails have the jail commission standards that you meet, just a bunch of different things. But each county applies a little bit of different ideals to how they want to manage their inmate population for safety and security of the SOs. You know, so like Lubbock County, we're very more heavy in the mental health management, right? Because it's a large facility. They're looking at security of staff, security of the inmate, and then also recidivism. So if they leave the jail and come back, how well are they managed in the jail so that when they're in the community that they don't come back on a mental health.
Okay.
So that's kind of what we would work with the Sheriff's Department and anyone in the community to say, what is the ideal? What is your goal for your healthcare services, especially on the mental health side? Because it's a big deal.
Corey, I'm glad to hear you talk about the transportation side, because one of the things that really is creating us a lot of problems, as well as I think every other institution in the state of Texas, is we're short-staffed.
Yes, sir.
And struggle constantly to be, fully staffed. And anytime you've got to send somebody to United Regional somewhere else to, have somebody in the hospital, it really throws our guys in a real scramble.
Yes, sir.
And so keeping those people on site is vitally important to
Correct.
the bottom line in this budget. Am I to understand, or are y'all using this as an extension of your educational program? Are you bringing some people through this program that might be doing some training with Texas Tech?
Yes.
How does that fit together?
So Texas Tech Health Science Center is an HRI, and we have charters for academics, research, and then also community outreach, like
Okay.
care in the community. We primarily focus on addressing community health needs and providing the resources for that. But at the same time, we partner with our academic side and bring residents and nursing programs through as an education side as well. So we try to leverage as much of that possibility as we can. And I know that, like, for example, Midwestern State is developing some healthcare programs, professional and paraprofessional programs that would be ideally suited to get clinicals in a location. So we have a whole, Rebecca Ramirez is she's our chief compliance and legal officer. She runs all of our student programs. So what she does is she goes, we find the different locations. Like in Lubbock, the School of Nursing wants to put nurses through there as a clinical site. And so she sets that up. So we would work with all these different organizations, even residency programs like that, to bring providers, physicians, mental health clinicians, those types of people through your program.
This sounds like one of those really good programs that for some reason we don't know anything about until we hear about it, and we're thinking, well, why hadn't we been doing this? This makes way too much sense for both sides of the equation, and so I'm
Yes, sir. I would say that's a spot on description, because you don't think of Texas Tech as a business development
Right.
corporation, right?
Yeah, when they first brought this on it,
And
what?
so we kind of get comfortable doing what we do,
Yeah.
and then doing really good at that. And so we were really actually hesitant to work with Lubbock County. They actually put an informal RFP out, and we didn't respond. Just because we're a state agency, we're really more focused on our reputation and our outcomes versus money. And so we just it's a little scary, right? Especially, when you've never done it before.
Yeah.
But when they came to us and the bids were just really high, honestly, is what happened, I think. They didn't really tell us, but I assume that's why they didn't award the contract. And they came to us and said, can you do it? We want to partner with you. What would it be? And so that's why we just reconvened and we really put something good together. And it's worked really well. I was been surprised because we've been working with TDCJ for so long, and we kind of have a customization, like what we think it's going to be to get patients. Because one of the hardest things to do for quality healthcare is to treat a patient that you don't get to see.
Right.
So we were a little worried about that in our staffing and stuff like that. But we found is in the Lubbock County Jail, and then in our conversations when we go to conferences at the Jail Association, things like that, the sheriff's departments are really committed. The officers and the SOs are really committed to work to manage the healthcare. And we have found, we don't have no-shows. I get to talk to our TDCJ partners and say, we don't have patients who don't make it their appointments.
This seems a whole lot like a logical next step.
Yes, sir.
For that program. And
I agree. And
interesting.
the one thing about us, we want to, again, I'm told every day, don't put our reputation at risk and don't have bad outcomes. Because Texas Tech can't afford those things.
Yeah.
And so when we work with our staffing model, that we focus on the quality, like making sure we have the staffing, making sure we'd have a situation where we don't have absent, like we fill and recruit. Like we thought at Lubbock, we had like 5 RNs, on, just in case. We don't need them, surprisingly, but we built that up. We had agency in line. Because one thing we want to do is if we have a gap in a shift, we'd have to fill it. That was kind of our mantra. And so we thought, well, maybe we won't make any money at all. We'll probably lose a little money because at first when you transition staff. But we've done really well. We've had very few turnover there with our team. And some of those turnovers were the newer people and young people making some interesting decisions when they are in the jail, which I'm sure you know about. And so,
Corey, what is the staff at Lubbock?
the staff at Lubbock, generally we run 4 cards, 24/7, of your standard nursing and coverage. And so that is 1 charge nurse RN, 1 EMT to manage intakes and emergencies on the pods. One of the things that we do focus on is making sure an EMT and an LVN are similarly like level of care in a jail, but an EMT is focused on triage and emergency response. LVNs are for managing care. So we always have 1 of each on every shift, and then we have either 1 more LVN or 1 more EMT, so we have 4 per shift of that. That's 24/7. And then Monday to Friday, 8 to 5, when we run our provider clinics, we have a provider, we have a telehealth provider, and a kind of like a locum. She does some telehealth, and then she also comes in 1 day a week. We have an infectious disease nurse who works with the local health department. And so we make sure that we kind of take our operational administrative person away from doing those types of things. Because what we had found with the predecessors, the HSA gets tagged with all the responsibilities. And so we want to spread that out to specialists. So we have a nurse specifically for manage those health department, STDs, HIV, TB reporting, because that takes away from the person who's trying to keep the clinic flow as smooth as possible. What else do we have?
We have medication aids. We have 2 medication aids per pill pass. So, I mean, I don't think we would probably do that with
Yeah.
you guys. But.
So one of the things for us, was talking about medications, these are the people who administer their medications to inmates. That is the most fundamental risk that you have in your jail, is appropriate meds, timely meds. Most grievances come from that as well. Didn't get my Excedrin, didn't get my Tylenol. Those are the things that are kind of unserious because it's Tylenol, but because of where they are in their constitutional rights, it creates a lot of administrative risk. And so we focus heavily, like what we call medication aid. In TDCJ, you have to be a certified, in a prison, you have to be a certified correctional medication aid. So you have to go through a program and certification. In jails, you don't. Jailers can pass meds. We push our people through a program and they're clinically trained in all of our jails. And that's just something that we won't shy away from. We would never want to we would actually charge you a lot more if she's like, well, we do our jailers, we're like, we don't think you should use your jailers to do that, because it puts everyone at risk. Let's get someone who's going to report to an RN and be clinically trained to pass meds. So we have 2 of those per shift. They go around, pass the pills. Now, as we walked around your facility, we may change that model because you have such a cool facility. We may run our nurse clinics out in the pods and do your BPs, insulins, and your drug administration out in the pods with an LVN. And you wouldn't want to put a CNA out there because they can't do all the other stuff that you're going to do in your kind of mobile pod-based clinics. So in your scenario, we were probably looking at using nurses and EMTs to be out there so they can run everything together. But that's just because we liked your facility and it seems like a really cool opportunity. Instead of bringing your staff, bringing people from pods to the clinic, we can go to the pod, reduce your burden on your SO staff from having to bring people to the clinic.
What is the population of Lubbock jail, anybody know?
1450.
That's what?
1450, right? 1450 now.
Wow.
They are
More than double.
I was thinking
probably
700 or
about
800.
yeah, and they're
Yeah.
going through a process of another 1,000 beds. I would say they are probably around, would you say 70%
On meds?
well, 70% on meds, but 70% local and then 30% contract, federal, and other counties. Yeah, so they try to keep themselves at about a 90% census
I see.
through contracts and marshals and things like that.
And Lisa, what does a shift look like for us under our current medical?
Jail staff or medical,
Medical.
there's one RN, I believe it's 3 LVNs, an EMT, and those are 12-hour shifts, 4 blocks, and then, we have a Monday through Friday nurse practitioner for the medical provider. Right now.
Their model is more specialist heavy than what we have now. About similar though on the.
I think your
the
nurse staffing is
24
the same.
Nurse staffing, yeah.
Yeah.
The same.
Well, the medication end of that deal, because Will and Lisa have a lot of customers that are really good at self-medication.
But
Well-
it seems like we have roughly the same number as Lubbock would have with
With fewer
nearly
inmates.
Yeah.
twice the inmates they have over us.
You have the same staffing model as Lubbock County, essentially, from based on the RFP that Kiana did the research through and did a calculator.
Yeah, I mean, you basically have the same number of clinical staff, the RNs and EMTs and things like that. Even if you don't have the infectious disease, nurse specifically, you do have that RN position right now.
Yeah.
You have 5 on a card, right?
I think
Yeah,
so.
yeah.
We have 4 on a card.
Are we understanding that we can cut the staffing, or is it because of the way the population is laid out that we have to have that staffing, or what?
I think
what's
the takeaway is I think we'd really need to look at it. We just did a very cursory overview of what the RFP was, and the bid, and just what we replied is, for what you have in your RFP, are you paying about the right amount? Not, do you have the right amount in your RFP, right? We didn't, because we just walked through for 20 minutes and don't really know a lot about your operations and the acuity of your patients. But I would say that would be one of the first things we would look at as we're talking to you all, is what would be the right sized staffing model for clinical to manage that most effectively.
So just so I understand, we understand your connection with TDC. Are you operating this program in any county jails now?
Lubbock County Jail,
Lubbock, yeah, Lubbock.
and we have a contract, we have a telepsychiatry contract with Titus County
Okay.
that's just signed, and we are in contract negotiations with 2 other counties. And all just since, when did we go to that meeting? April. So, but one of the things, just so y'all understand, is we will look at your timing. We're not a vendor of services, and so, and we're not necessarily trying to go outside of where we already have a presence.
Yeah.
But
We're just a
someone-
natural fit because of Midwestern.
Natural fit, but we are not gonna take on multiple clients at the same time. So we kinda have a plan, and if I understand the timing, we're gonna make sure, like as we talk, we'll make sure that our timing is that when we come, if we come and we have an agreement with you, all of our team will be committed to the transition. And then for like 90 days minimum. That's where we were with, we didn't even start agreeing to having a conversation about contract negotiations with other counties where we're doing on-site services until we were 90 days past Lubbock. And that's gonna be our same model. Just because the transition is critical for us. It's critical for y'all, obviously, but it's for us because, again, I'm under pressure to not put our reputation, our double T's at risk. So it's very important that we stage this out and we don't try to get too big of an appetite.
Don't wanna take too big a bite.
Yes, sir, that's correct.
All right. Understandable. Interesting.
Yeah.
It's good stuff.
All right, any other questions? Y'all have our contact information. You'll be our point of contact. We have other information that we can share to Captain, but if y'all need something directly for the Commissioner's Court Judge, just let me know.
Okay.
We'll send you information. But for now, we'll work with the Sheriff's Department and just continue those conversations.
Okay.
All right, thank you all.
Real
Appreciate
quick
you.
question.
Yes, sir.
You had mentioned early on that there's already some staff here servicing all red, like dental staff, et cetera. would we be able to utilize that same staff?
Yeah, I think like for dental, we don't run, if I remember right, at All Red, we run a 4-day clinic, and you have a 1-day clinic.
Right,
So we have a dentist.
so,
We should probably have a dentist to cover your 1-day clinic because we're already on a 4-day.
okay.
But more importantly, we have trained people who understand how we work locally, so that if we had to do stuff, because they have people that will take call. We do a lot of people taking overtime to cover shifts rather than when someone's out sick. So we would be able to, at scale, potentially have those folks work in both places. So you have, both sides actually have more of a pool of people who are willing to come in and
That would
work.
be a good
Because nurse agency is really expensive.
Yeah.
Yeah,
And if I understand your contract, it's really expensive for you.
It's expensive for us up to a point, and then it's really expensive for them.
Right. Just so you know, with Lubbock County, we don't have that. Whatever our cost is what our cost is, so we take the hit on our agency on hour 1, just so you know. Because we're responsible for making sure the
The
staff.
one thing that can be a lot more expensive is not taking care of it.
Yeah,
yeah,
and I will say, I mean, I think the one thing that I want the whole community to understand is we're gonna come in and provide healthcare services that are high quality, consistent with what you're accustomed to being successful with, right? But then we're gonna have people who care about compliance and risk management from a safety and risk perspective. You know, from a state or county governmental agency perspective, not from a different type of perspective. We have training, all these things that are already built in that we don't have to apply and add to our agreements. And you know that we're not going anywhere, right? So we'll be here forever. Texas Tech will be, and if I screw up, maybe I won't be, but we'll see how this goes. Okay, any other questions?
no, that was
All right,
perfect.
thank you all, I appreciate you.
Corey, Kiana, thank you both
Yeah.
for making the trip.
Thank you. You mind?
Yeah.
Is this against the rules?
I should have worn my red shirt.
Thank you, appreciate that.
Appreciate it.
Thank you.
Appreciate you.
Thank you guys.
Thank you.
You're gonna start a new tradition.
I didn't realize that I would be here for this talk, but I'm glad I was.
Me too.
Because I started my career in law enforcement defense at the AG's office representing TDCJ and the prison and the Texas Tech. So I was very familiar with their medical care. The prison wholeheartedly support Texas Tech and how they handle medical care in the jail. They really, in the prison, they really do a good job. And they handle that for the state. So they had the scale for it. But also being able to leverage some of their resources is something that we actually talked to Lubbock about when we were there, because with the breakup of Rose Street and our lack of having doctors to do competency evaluations, and our cost is increasing exponentially on that. As I just last week asked Matt for the numbers on that, so we're looking at those issues. Having another resource would be incredibly important for us in the mental health, working with Helen Fairby on the new jail competency stuff.
I will say, so Texas Tech provides the physicians 4-star care for their offset of their psychiatry. So we're already connected with that.
Well, and I'm like, it's fine. I'm glad you're here. I was thinking I may reach out to you separately, even unrelated to the larger piece,
Okay.
on if there's opportunities to try to coordinate there, because that'd be great. if we
Yes.
could.
Yeah, would love to do that.
Okay.
Yeah,
I'm
thank
Corey,
you.
by the way.
I'm Meredith Kennedy. I'm the judge of the 78th.
Oh, nice to meet you.
Nice to meet you.
Thank you. I'll have a good day.
Thank y'all.
Thank you.
All right, item number 2 is going to be receive county treasurer's report of money received and dispersed, debts owed by the county, and other proceedings in the treasurer's office for the month ending June 30, 2025. Unfortunately, Mr. Jones is ill today, and so we will need to table that until the 22nd of July. So Morgan, if you'll put that on the agenda for not this coming Tuesday, but next
Lisa's gonna give the report.
You ready?
Sure.
All right, we actually will move on to item number 3, which is review and discuss jail maintenance projects and work orders. Chief, what do you got?
Biggest problem we've got this go around is the gun range air conditioning AC units. One is out, needs to be replaced. we had to keep that whole range cooler because of the server room out there, so we did, we went out and got 3 different bids. The first one is basically just to replace the thermostats, cause I'm not sure how old that building, the thermostats are. I know we've had the building 10 years, if
Not
not
quite.
longer. Huh?
Not quite.
Think
I
it's
haven't been
15?
here 10 years.
Okay. And, so to fix the unit that's out was $942. So what we try to do, we have to keep that bigger building cooler because of that server unit. So we went ahead and just got a price for a split unit to put in that server room, where we didn't have to run the other ACs as much, to keep that majority of the building up on temperature. And the split unit was $3,500. So the fixed unit was $942 to fix that one unit, but we would still be having to cool down the whole
Yeah.
building, so.
It should have its own.
Yeah, and we may be able to just leave that rest of the building at 80 or so, cause you know, we're not out there every day, but the server room needs to stay cool. So those are the options I have. I'll send that in an email, we can put it on the agenda
Okay.
to
You
talk
mind
about.
have Rick look it over first?
Yeah, we can,
Yeah.
I can send all that stuff to Rick then.
Okay.
And then, go back to my email and work orders. We did have some leaks with the recent rains, some additional leaks. I know we're waiting on the.
Work in progress.
Yeah, work in progress. For the last week, we had 44 work orders that were filled and completed. There's no work orders over 30 days. The cameras that we ordered back, I don't know, a month or 2 or 3 ago, they should be in January. So, they're not in a big hurry to get here. And really, that's really all the work maintenance.
We did our final walk on the courthouse yesterday, and I know Linda had sent some emails yesterday about reopening,
Yes.
the intake area.
Yes, and we had created a policy that was already approved by the jail commission in 2024, well, actually almost a year ago today. And so in that response to Glenda, I went ahead and sent the policy that we have and just have them give it a once over and see if anything needs to be added or removed.
Are they gonna
So-
have to come down and do a reinspection for compliance, or?
They may, since we're done with construction now, but I have not heard.
Okay.
But I will keep
Just-
everybody up to date if I hear anything.
Just
about it.
so, we probably need to go do a once through and make sure there's no,
I know there was some cells that we wouldn't be able to use just because of the changing in the rules with ADA and stuff like that, but, for what it's gonna be used for, I don't think that's gonna cause a problem,
okay.
so.
Are we still have construction stuff in the runaround or
I
solid
think
board?
most of that's gone.
So can we turn around in there yet?
I don't think
It's
so.
been a while since I've been down there,
Okay.
but yeah, they were moving stuff out a couple of
Okay,
weeks ago.
so
I
we're
haven't
getting
been in
closer
there.
to being able to.
Yeah,
pull
it
in
should
and
be,
turn around.
other than some stuff that we have stored in there, yeah, you should be able to,
Pretty soon, okay,
yeah.
yeah.
So, no other steps that I need to take or?
I don't think so. Just waiting on the commission to see what they say, and then if we do have to do a reinspection, then,
Okay, awesome. Good deal.
Cool.
Glad that's done.
yeah, we can get the trusty crews down there to clean everything up and get it all nice and pretty again.
This is for either y'all or Ricky. Any update on the roof at the LEC?
No, I haven't got anything back from Carlisle yet.
Okay. Alright. Any other questions on jail maintenance projects and work orders? Okay, let's move along to item number 4, receive status report on salaries and overtime.
You'll have the overtime paperwork. So, to kind of piggyback off what Lubbock County said, this past 2 weeks, we had 244 hours of guard duty at the hospital. It was all overtime, so we had to bring somebody in to guard inmates at the hospital. We are down to 4 openings this morning, or yesterday actually, which is good. We started quite a few this week. Part of this payroll also has a week of jail school from 2 weeks ago, and jail school is over, so.
And it'll probably be either on the agenda this coming Tuesday or the following week, but we have renegotiated the marshal service contract, so that number will be increasing by about 50% soon. You probably know a question that's coming because I ask it nearly every week. The courthouse security overtime duty, is that, I'm looking at who it was. It looks like it was more actual courthouse security than jail work.
I know we had at least 9 hours overtime. We did, that day they had the, march down here.
Oh, that's
I
right.
did put somebody in each one of our facilities for
Okay.
3 hours. And then, I looked that up too. And the rest of it's just coverage, opening and closing.
Will, when, someone, let's say someone from out of county goes to the hospital and has to be attended while there, who's it, are our jail staff doing the attending?
So we will sit with them initially, and then we notify the agency that they need to send somebody up or potentially transfer that inmate back to whatever unit, and they pay all the costs for that.
Okay.
Now, I don't know if we get I don't know, I'd have to look at our contracts, but I don't think we get reimbursed for those initial hours of,
Right.
of transport when we're sitting at the hospital.
I
I don't,
think it should be
I-
everything that it's
yeah, I know
involved
we
with it.
do in the US Marshal contract. I'm not sure, I'd have to go back and look at our contracts with our counties, but,
That's what I was wondering about, if it
Yeah.
flowed through.
typically we don't,
Should be.
Yeah.
we typically, we don't sit at the hospital with out-of-county inmates unless they're not non-contracted or contracted out-of-county inmates.
Right.
They'll usually come get them.
Everyone good? Y'all still looking?
I'm good.
Good. Okay. All right. Item number 5, review and discuss regular bills. Thank you. Matt, Margaret, any weird stuff we should be on the lookout for this week?
I think we skipped a week of weird stuff,
Okay,
just for you, Judge.
thank you.
You're
I
welcome.
put in that request specifically.
The only thing I would say would be, you'll see that there's Road and Bridge Precinct 5 on there, and those are just maintenance charges for the equipment that is still a part of Precinct 5.
Yeah, the chipper and the asphalt tipper, chipper and
You're gonna see some of those big oil bills here in the next,
oh, yeah.
next couple of weeks.
The Baylor University medical bill for
That
indigent,
is
do we have to
for-
send somebody off?
Yes, and actually, that is not what would have been paid on that bill, that particular person, that made them meet their $30,000 cap. There was actually $808,000 bill that came in after that one.
6 digits, 808?
No,
Thousand?
108,000.
Still 6 digits,
Yes. So we obviously didn't pay anything on that. That particular bill should have been a little over $12,000 that we paid, but that was all he had left.
It went to Baylor. I guess we had the proper referrals and everything in place.
So, he must be a sick one, because we get
Yeah.
lots of bills for him.
Well, it runs out at 30, so.
Yep. He's done till September 1st.
We start on the state calendar on on that?
Digits,
Okay,
yes, sir.
I know everything else there starts to stay. I didn't know we started the clock on.
That's when the engine starts, yes.
I just learned something new about it.
See, there you go. Every day you learn something new.
And for that indigent services, that insurance program has caught numerous people so far. So
Yeah.
I think we're at over 20.
Yeah.
And so that's
Which
been a great
is-
tool.
Outstanding.
Yeah, I've done some claims and asked them to, bill their insurance carrier first and give them the information. And a couple of them came back with, you know, the reason why they can't something, but I haven't received anything back yet, so I'm assuming they're gonna bill their insurance company and then
Yeah.
talk it back to us. And I had one today that actually billed the insurance company and then billed us for the remainder. And it was $18 and something, the remainder.
Good deal. That's excellent news that that's working.
Did- On the city of Wichita Falls, the big bill, I'm assuming that's fuel,
Is it in the gym?
says,
But I mean, are you looking at the general operating account?
yes, uh-huh.
It's probably the sheriff's, it's
Yeah.
like $16,000. That's the fleet bill for their maintenance and the fuel and everything.
Does that roll back into their budget?
That's paid from 560.
Right.
And
Okay.
like maintenance has that, there's several fleet, because maintenance everybody who has a
Okay.
car pretty much, unless they're precincts, and precinct 1 actually has an account there,
Mhm.
but the rest of you guys don't.
Right,
But Brendan has an account there, there's an IT account.
right. But it rolls into their, lines within their budget?
Yes, sir.
Yes, yes.
Okay.
Still working, Jeff.
No, I'm good, Judge.
Mark, are you still? It's
One
fine
more.
if you are, just a second.
You can go on.
Okay. All right, any questions on regular bills? Okay. Item number 6, discuss county facilities and priorities for construction and renovation. So, a couple of things have brought this item up on the agenda. The first was, in preparing for the 26 budget, a new piece of the budget I'd like to have this year is an actual multi-year plan for where we think we're going with permanent improvement, so that we have an idea of how much money is gonna be necessary over the medium term, so that we can start planning and knowing what we're looking at from the standpoint of transferring funds in. But also, to some degree, to have the conversation about, with most of the big renovation projects under the current one finished, across the county and with the courthouse, what are we looking at for the next
You're gonna be talking
4
a
to
lot.
5 years? Yeah, come on down.
They hear you better if you're sitting there.
So, I visited with Commissioner Beecham and Ricky, as part of our normal budget process meetings back in late May, kind of walked through what specifically we knew we were looking at for the rest of this year and next year. And then visited with them about, more broadly, the needs and the plans for beyond. This is, especially once we start looking beyond next year, there's a lot of caveats and none of this is decided and the figures are very much ballpark, so I want to give those caveats of whoever's here, either watching in the audience or on this dais. This is all still very much in flux, but we've got to have in my opinion, we need to have a map to start from so that we all broadly know where we're going, so that we can start the planning and making more decisions. So with that, we've got, I think each of the commissioners, you should have a roadmap that kind of outlines where we are. I'm just going to walk through that because, of course, everyone that's out in the audience doesn't have that, and I didn't have the foresight to get it on the screen, so I apologize for that. But what we're looking at for the rest of 2025, we've got to finish the concrete projects, which we actually have an item on court's agenda this coming Tuesday to handle that on the east side of the building. Need to do work on the air handler unit for the first floor. We've still got the exterior doors for the IT entrance and the west exit that we need to replace so that they're able to do our security overhaul that's happening this fall. Of course, we've got the Iowa Park Annex with the construction we need to complete on that. The Burke Burnett Annex, we should begin construction on that before the end of the year. Juvenile detention has an issue where we are needing to seal and resurface the walls for the dormitory units and the, not isolation units, I forget what it's called.
Solitary.
Yeah, the hallway there. Yeah, right outside there. So we're gonna do that before the end of the year, actually probably coming up pretty soon. Some work in the parking lot of JJAEP, and over at the courthouse annex, we've got to do some renovation work for the new IT suite that's going in on the second floor, and some work to clean up the third floor archives office to prepare it for any future occupants it has. Throw all that together for the rest of 2025, we're looking at about $786,000 we're going to be spending the rest of this year. With permanent improvement fund balance being where it is, we'll end up at the end of the year with about $4.2 million.
Is the Burke Annex should be complete this year?
No, we should start it this year. Planning should be done, and I would think
so-
some construction.
So the dollar allocated here is just a partial?
Yes.
Okay.
Yeah.
There's the big ones.
And Commissioner, y'all did dedicate some ARPA
ARPA
funds
funds.
for that Burke Annex, about $770,000.
Okay.
And I did not account for any of the ARPA funds coming out of this because we had to plan, without it, just in case something does happen and we know. So that takes us to the rest of this year. In 2026, over at the courthouse annex, we've got some painting on the second and third floor that's going to be done in-house. Big ticket items, we've got two of them over there. Number one is we've got to do an HVAC system replacement on the second floor. And Rick, feel free to jump in if you want to add some details on that. But that's not including replacement of the units on the ceiling, is that right? I mean, that's a $450,000 item. Some ceiling tile and grid replacement on the second floor. And then talking about doing lighting for the parking lot over at the annex side. Again, it's another pretty big item of $200,000. Over at the LEC, need to do some security work in the server room. Juvenile detention, we've got to do an RTU serving the courtroom, some concrete repairs, some retiling of their lobby restroom floors, and then finishing the sealant work on those walls for the dorms. At the courthouse, before I jump into this, I want to speak to this. It's my opinion, and this map is done with this in mind, for 2026 to be a year where we do exterior work and HVAC type work that we need to do, and not start any of our next cycle of renovation projects. I honestly think it'd be good to have another full year of everybody
Of calm.
not dealing with big projects. So that's what this map has in mind. You'll see what we've got for 27, 28, 29. Morgan, you emailed to Brendan, thank you. So with that said, got about $10,000 for landscape projects.
What is that?
Work to complete air handler
Air
unit
handler
and
unit.
add reheat for conditioning of space. Ricky, what section of the courthouse is that for?
That serves the, first floor, or the lower level, first floor, and then the second floor.
Okay.
So,
That would be the south side of the second floor.
yeah, mail suite and,
Yes,
Yeah.
yeah.
And that's about a $300,000 allocation. Then we talked about exterior remodeling on the east side of the courthouse and the south side of the courthouse, where it's called the wine rack,
wine rack, pigeon coop, whatever.
where that is, because we're starting to see some water leak issues in both of those places due to that. And if we're going to do the work to remedy the leaks, it probably makes sense to do some aesthetic work on that as well. We don't have any idea of what the cost on that is likely to be, but doing that work, and then talked about doing design work for the next phase of the project, which I'll get to in a second, and then finishing up the work on the Burke Burnett Annex to complete construction, which has about $900,000 for that. Those numbers for the Burke project were based on what we did, similar dollar spend as what we did in Iowa Park. But again, until we've got plans for that, those are ballpark numbers. You want to add anything to 2026 before we move on, based on what's there?
No, just a kind of an explanation for a lot of the systems that are in place, matter of fact, probably all of them, when they were installed, there was no provisions in the installation to handle humidity control or anything like that. And so, West Texas used to be dry. We used to use evaporative coolers, and we don't anymore because it's wet. And system design didn't dictate, hey, we need to take care of humidity, but now we do, and probably have been for quite some time. So a lot of these upgrades that we're trying to do on the HVAC system is to address humidity control and then temperature control, space control, and those offices and stuff like that. So anyway, it's just antiquated, and we're just trying to bring it up to date and make it where it's functional.
The second floor of the annex has the same issues that we had on the first floor. It's perimeter heat, so it's very inefficient. We're not moving air correctly through any of the space there. And when you open the air handler room, it's like going into a wind tunnel, 'cause it draws so much air straight down the hall into it. Yeah, it's about 30-mile-an-hour wind when you open the door.
And so if anybody's here from the second floor of the annex, help is on the way.
So the dollar figure on the 2026 projects comes out to about $2.4 million for those projects, which leads us to a running total for 25-26 of $3.188 million. And that takes us to 2027. Talk this through, and again, this is early days, but what we're talking about doing is we've got, for those of you who've been up on the fourth floor recently, we've got a bunch of unused space up there, the old jail side, that is completely open and unused right now. We've talked about moving the DA suite up to the fourth floor, finishing that out, moving them up there, giving them an additional, increasing the footprint up there, and
By about a third.
yeah, by about a third. And I guess I should have started with this. We are in a position right now, because of the work that has been done, where we're set up nicely for future work, where we could, and this is what this roadmap is designed on, we can order the projects in such a way that we wouldn't have to displace any office, courtroom, while the work was being done to prepare the new space. I wasn't here for pre-2023, but I know that was that was a challenge for all offices that were affected. On the back side of that, we've got a bunch of great space, but I've heard what a challenge that was. We're in a position where we can do the work, not have to displace, then move that office into their newly prepared space, which frees up the next phase so that we can do the same thing. So the fourth floor would be doing the space to create a new DA suite for the fourth floor, doing some additional restroom work on the third floor to accommodate what's probably coming with additional needs on the third floor, and then to take that suite that's open, or take the current DA space that's opened up and to build out a new 78th District Court suite and courtroom in that vacant space. The idea being there again, we'd be able to work on that, get it ready without displacing a court. The total cost on all of that, again, very much ballpark, would be about $3.75 million, which brings a running total of just shy of $7 million. Then in 2028, we'd have to renovate the old 78, which would now be empty, because they're in the new space where the DA's office and suite used to be, to create a new 89th District Courtroom by taking in the law library and working and building out that area. To move the 89th into there, it'd be a cost of $500,000. Then in 2029, talked about moving County Court at Law 1 up into the vacant space that the 89th just displaced from.
I don't think that 500,000 is gonna get us there.
Ballpark numbers. So that at the end of all of this, all of our courtrooms, minus child protection and child support, and the JP courtrooms, of course, all of our courtrooms would be on one floor. And then once the County Court at Law 1 space was opened up, talked about then moving the child protection court to that space. Okay, there it is.
And there's some other issues too that we didn't hit on. I know male suite in particular is very difficult to condition because it sits right over the top of the boiler. There's some thought about potentially moving your location to where IT is currently, because IT is moving out. So it'd give you actually more space than you have currently, but we don't have the problem with keeping you cool and warm that you do now. But that's a potential.
Sure.
So
It would be nice to not have the humidity and the weird,
and
some weird
that's
things in there.
that's a low cost potential to move
Yeah.
you over there, and it solves some issues that we just can't resolve otherwise.
So it
without
wouldn't
great
be, well,
expense.
and I guess if the plan, if the plan is to move up to the fourth floor for the possible whole DA's, I didn't know if it was including our section.
So that was I was gonna
Maybe I missed that.
say that in there is that we could also, because again, this was all, we haven't had any conversations with any of the stakeholders on this. This is sort of the introduction so that those folks can be thinking about it, to come back and go, this is why it's a great idea, but make these changes, or this is why that won't work, and for us to have those conversations. I wasn't sure if y'all needed to be separate.
And that's something that the kind of the first time I thought of it really.
Right.
So yeah, that'd be something
Well,
that John
we
to think
were-
about too. And
We were out of space, Mel, when we did that,
Yeah.
and that created Meredith a space that she could actually, because they were.
Yeah, I
so
remember how
cramped.
it used to be crammed up, because I was an intern up there at one point, so in law school. So I remember where they used to be, as opposed to the new spot and all of that. So I'm kind of familiar somewhat with that, and it does work for us. It's it works, but yeah, it could be better with the temperature wise and all of those things. So and
That's just a possibility, so I'll just throw that out there
well, I mean,
as a
it's really something to think about.
potential location for you to land, or you can stay right where you're at. But we do have problems that we just really can't resolve feasibly without going into great expense.
I thought there was some discussion of putting new windows in our current spot, and I didn't know if
Yeah,
that
well,
would fix
that-
it, and that probably won't fix it.
That'll happen with the exterior renovations, but that's still,
Yeah.
you still got that boiler right underneath you that when we turn that on, you're gonna melt, and that's
Yeah.
the problem.
Yeah, okay, well, that's, I'm all for getting some more comfort for everybody. Not having space heaters on at weird times and all that have to happen.
And as part of this, especially on the courthouse side, there's gonna be some HVAC work that's going to need to be done as well. Try to incorporate that in these numbers, but who knows? That's one of those things that.
That's one of the big reasons for moving the DA's office up to 4, is there's an ongoing issue with HVAC problems. It's again a perimeter system that was put in the 80s. It's never been upgraded or maintained properly throughout the years, and Rick spends more time fighting with that system. We looked at a potential project to start replacing that. It would create months of disruption for the DA's office, where we'd be displacing each office similar to what we did in adult probation, which was not comfortable for them. We had to work through a lot of logistics to keep them operational. A little more difficult to do, I think, with the DAs with their active cases and everything, to play checkerboard with them all the time. So moving them up to the 4 in a completely brand new space solves that HVAC problem. Does not displace them except for one move. Plus, we'd originally looked at that 4th floor to house 2 new courtrooms, but the expense in the utilities, moving things around, we can avoid a lot of that unnecessary expense by moving the DA's office. Just the way it all lays out and works. I think it's by far the least expensive route to go.
And since we've got our judges at the 78th and the 89th here, and I know that it's a little odd to move the 89th where the 78th is now and move the 78th, but again, the reason for that would be you're not displaced, and it just allows for the natural progression. This is, again, I don't know that during no time here, have y'all ever had a discussion about the medium, long-term plan for facilities? It's been a while.
It's been a while.
And we are now at the point with all of the ongoing projects either done or nearly there. We need to have I wanted to lay this out so we could have a discussion, and quite honestly, so that folks that this would affect have an idea of what we're talking about, so that they can provide feedback and let us know before we get too far along a path.
Is the grand jury facility still functioning?
Yeah, it's fine. It's away from the boiler, so it doesn't have the same issues.
Well, part of that suite that Mel's in, that was all part of getting that grand jury room in place back when it happened, so that was kind of a spin-off.
You shook your head. We have problems in there with heating and everything?
No, I just glad they don't have those. It's already a public service for them to have to come in, and I don't wanna make them, we don't want them to
Okay,
have
so
to
I was not
sacrifice.
aware that we were having the same issues.
No, we're not that I've heard of.
Okay.
Mel is on the hot seat.
But I think this roadmap provides a less painful way for everybody to get improved facilities, so.
I'm gonna go tend to my 11 o'clock.
Okay.
They're not gonna wait long. Thanks, y'all.
I don't hear any protest.
Thank you, Judge.
They're thinking on it. The protest will come later.
Give me 5 minutes.
Yeah.
But essentially what that would do would put all of family court services, so to speak, on 2, most every court on 3.
Yeah.
Every court on 3. So.
Yeah.
So it'd be a real good consolidation.
So everyone can digest that, and then you can shoot holes in it. which is, we're inviting, again, before we get too far down the path. And as y'all know, because you've heard me talk about this the last 2 budget cycles, I want to be able for the public to clearly know if we're taxing them to have money sitting in permanent improvement, what the plan is for spending it. And so, knowing that that can change, especially when you're talking about something 3-4 years out, but that we do have a plan and we're working on it.
Matt's one has to write the checks and he didn't pass out, so that's a good thing. That's a good
Well,
thing.
I would ask, cause on Tuesday we had rescinded the 2025 budget transfer of $2 million from the county's general fund to the, permanent improvement fund. Since we're about to, look at a proposed budget and then in September pass a approved budget, are we looking at a transfer in 2026 to the permanent improvement fund? Or because that estimated fund balance will be about 4.2 and there's only about 2 million in 2026 projected, that we would not do a transfer?
Stay tuned. My guess is we'll probably do some transfer rather than try to get the fund built up. Cause the big dollar years for this plan, it's a little bit 26, but more than that's gonna be 27.
Right.
And rather than have a $4 million transfer all in one budget year, I think I'd rather do that over time. So
Right.
we'll probably do some transfer next year.
We really don't have a good idea what the exterior is
Yeah.
gonna cost.
Right,
at this
and then we have the transfer from ARPA that's gonna be the 770,000
Covering the burden.
covering Berg,
Yeah.
so.
So
You know, Judge, this long-range plan is really, I think, a good idea, and it fits with the commitment that this court made a number of years ago when we decided that this was gonna be our footprint, and we were gonna take this building and we were gonna make it work, and that's when this addition got done, which is what started really the whole process, because we were needing room, and I think that goes right down those same lines. There's no need in leaving an old bombed-out building here and moving off to a new footprint. I think it was a good decision, and I think that plan follows it right down the line, so it's a good idea.
And whether it was the plan or not, I'm gonna assume that it was, but we are set up to be able to do these things without having to displace everybody at the
Yeah.
time. It's
Which is huge.
Yep.
You know,
And,
it really
and
is.
laid out like
Plan
this.
has changed over the years, but
Yeah,
it
yeah.
was the plan to play checkerboard, but.
Yeah.
And affordable. I
Yeah.
mean, the way it's laid out right now, it's something that we could bite off, where
Well.
spending 12 million, $10 million like one chunk is
Right.
difficult.
Well, we haven't raised taxes specifically for permanent improvement funds, so
No.
we just continued the same funding source that we've had since I've been on the court, so.
This is the way that people do it in the private sector. I mean, you have to plan what you're gonna do and eat
Save
little-
over time.
Save up and do what you can do. So this is not asking for a big bond or anything like that.
Right.
Better way to do it.
All right, and again, this is not the last word. Heck, this is not really even the first word on that standpoint. But any questions or comments on that item before we move along to closed session items?
Judge.
It's nice to see a 4-year plan, cause, before I poured my second cup of coffee in county government, Bill Preston said, we've got you slated for a remodel, and I got one 10 years later, so it's nice to see, it's nice to see these numbers compress. Not that I'm toting that around or
We
anything.
still move at the speed of county government, so.
I'm not toting it around.
Well, a flood could happen at any time, or a fire, or anything, so these are plans and they're goals, but they could change at a moment's notice.
And I fully know that this plan is only possible because COVID happened and the ARPA money came, which allowed for other things to happen. So
Yeah.
you make plans and then what's Mike Tyson quote? Everybody's got a plan till they get punched in the mouth. Well, but
You look so good in sawdust anyway, so, you look so good in sawdust. So,
Judge, can we get a copy of that
Yeah,
draft, please?
absolutely.
Thank you.
Was your wait worth it?
Yes, sir.
Okay.
Yes, sir. Yes, sir. We're very happy.
I hoped everyone else would understand that too, that even though it's not gonna happen overnight, that the wait will be worth it.
We couldn't be happier without turning that on.
Yeah.
I mean, that as a whole, the court was a great project.
all right. Any other questions, comments? Okay, well, with that, it is 11:13. We're gonna move into closed session for a briefing and discussion with Purdue, Brandon, Fielder, Collins, and Mott LLP law firm regarding delinquent court collection procedures and strategies. This meeting is closed pursuant to Texas Government Code, section 551.071, consultation with attorney. If you have not been pre-approved to be in the courtroom during this closed session, I ask that you vacate immediately.
Listening to you.
PM.
And we are back into open session, and with nothing else to do, we will adjourn at 12:32.
Mel,